Hi, so today we're going to do a journal critique on ginkgo biloba and donepezil. It's a comparison in the treatment of Alzheimer's, dementia, in a randomized placebo-controlled double-blind study. My name is Sagesi Tarif, and this is Shanae Brown.
So, a little about the background. Dementia is used to describe signs and symptoms of impairment of memory, confusion, mood swings, and difficulty performing day to day tasks. So, Alzheimer's disease is the most common cause of dementia in the United States. In the US, currently 35 million people are affected, and it increases with age. So, 15% of those people are over 65 and 50% of those people are over 85. It's expected to increase to 13.8 million people by 2050. Alzheimer's disease is also thought to be associated with genetics. It's seen in people between the ages of 40 to 50 with inherited gene mutations associated with ApoE4, which is the gene that they think is associated with the disease. And also, children of people with Alzheimer's have 50% more of a likelihood to also have this disease. So Alzheimer's, it happens gradually and it increases as time goes on. So the first stage is short-term memory, so forgetting to turn off the TV or forgetting to where your car keys are or the light switch. And as it progresses is when you start to lose abstract thinking and intellectual function. So you're going to have trouble with figures or working on bills or organizing day-to-day work. And you're also going to have disturbances in your behaviors, your agitation and irritability. In the late stages, when you're totally incapable of caring for yourself, and death is more common and is more associated with the late stages. So you don't die due to the disease, you die with the disease. So what this means is you usually are going to die from a secondary infection, and the most commonly one associated with Alzheimer's is pneumonia. The causes of Alzheimer's is unknown, but researchers do think that it has to deal with the beta amyloid plaque buildups and tau proteins in the brain that become disoriented in people with this disease. And as far as treatments, unfortunately, there aren't any treatments that slow down the rate of Alzheimer's, but certain drugs can be used to alleviate symptoms. And these drugs include cholinesterase inhibitors and partial glutamate antagonists and donepezil. So the two drugs we will be focused on today that we're discussing in this article is ginkgo and donepezil. And ginkgo is an herb which is prescribed for the treatment of Alzheimer's, and it basically helps to improve cognitive functions, they think. And donepezil is indicated for the treatment of mild to moderate Alzheimer's. And there is evidence that this drug has efficacy against the major domains of Alzheimer's, which include functional ability, behavior, and cognition. The aim of the study is to assess the efficacy of ginkgo in patients with Alzheimer's, and if it helps to slow down the degenerative progression, and if it helps to improve patients' cognition impairment compared to that of donepezil and placebo. So our research question is, will ginkgo biloba be as effective in slowing down the degenerative progression and improve cognitive recognition impairment in patients with Alzheimer's compared to that of donepezil and the placebo? So as Sagesi stated, this was a randomized, placebo-controlled, double-blinded study. What they did was they took patients between the ages of 50 and 60 years old who were diagnosed with mild to moderate Alzheimer's, and they were allocated into 3 different treatment groups, and those groups included ginkgo, and the people in the ginkgo group took 160 milligrams a day, donepezil, where they took 5 milligrams a day, and the placebo. And inclusion criteria was met, which we will discuss later. They used SPSS software where they tested laboratory tests and computed tomographic scans were performed, and they tested on SKT, CGI, and MMSE, which we will discuss later. And the duration of this study was 24 weeks.
So the general study population were patients aged 50 to 80 years old suffering from mild to moderate dementia. They were diagnosed using the Diagnostic Manual of Mental Disorders, DSM-IB. Some inclusion criteria included a mean score of 3 to 5 on the Brief Cognitive Rating Scale and a Hakenskay ischemic score of less than 4. Presence of any adequate level or premorbid intelligence, which was an IQ score greater than 80, were included. SKT score between 8 and 23, which this test was the syndrome Kurtz test, and that was testing the type of dementia that these patients had. The exclusion criteria included other types of dementia that were outside of the mild to moderate, severe diseases such as tumors, brain trauma, epilepsy, any use of any illicit drugs, or excessive alcohol use. Pseudodementia or history of schizophrenia or psychosis, those patients were also excluded. 117 patients were enrolled in the study, 41 were excluded, and 76 were randomized into the three groups. 15 participants were withdrawn from the study, 5 patients being from the ginkgo, 4 being from the donepezil, and 6 being from the placebo group. This is our descriptive statistics for the study. So this basically shows the baseline scores, and as you can see, the number of patients were evenly distributed between the three groups. The male and female ratio was about even, and the average age was about 68 years old, and the MMSE, which was measuring their mental state, that was about 18. The majority of the patients scored about 18, and the SKT, which was assessing the type of dementia, was about 14, and the CGI, their cognitive impairment, was about 4. The statistical analysis used in this study were the SPSS software. T-test was ran in comparing each group from baseline to 24 weeks of treatment. Also, an ANOVA test was ran to detect the differences between the groups. So some of the factors used for the ANOVA test were age, gender, and severity of impairment. All data included means and standard deviation, along with a 95% confidence interval and p-values. These are the treatment variables that were found in this study, the independent variables being the ginkgo biloba and the donepezil, the dependent variables being cognitive function, progression of dementia, and therapeutic efficacy. Some confounding variables included the low doses of benzodiazepines and neuroleptics that were permitted for the study subjects if they were having any behavioral disturbances. Also, another confounding variable is participants' compliance and adherence to medications.
So, results. So, there was a statistical significance observed between ginkgo and donepezil in the t-test comparison, and both groups also showed a significant difference when compared to the placebo group in the ANOVA test. The placebo group did show a statistically significant worsening, as you can see, with a p-value of 0.01. And there was no differences found in comparison between donepezil and ginkgo. So this figure is showing the MMSE scores at baseline to the end of the study at 24 weeks. And as we discussed, that MMSE is the mini mental state examination, and subjects had to have been between a score of 13 and no more than 25 to even be considered for this study. So as you can see, improvements of the score in the patients who were in the ginkgo and donepezil group did improve, and there was a slight worsening in the placebo group. There was also no significant changes observed for each group, and the ANOVA for the treatment differences showed significance for both the ginkgo and the donepezil group.
These are the results seen for the SKT test, which is the syndrome Kurtz test. This test measures the degree of severity of the dementia. So as we said before, participants had to have a score between 8 and 23 to be included in the study. This was based off of a scale of ranging from 1 being very good and 27 being very poor. So as you can see, the ginkgo and the donepezil group had a decrease after treatment versus the placebo group had an increase. So this also is another graph explaining the CGI testing, and this was basically the clinical global impression test to measure their cognitive function. As you can see, there is a decrease in the ginkgo and the donepezil. So 1 was the scale being very much improved and 7 being very much deteriorated. So as you can see, there was a decrease in both of the treatment groups. So this is our critique. Some of the strengths that we've seen within the study were randomization and double blinding, also true control. Those help decrease the bias within this study. Also, the specific inclusion criteria, the different tests that were ran, such as the MMSE, SKT, and the CGI, helped to narrow down the study population. Ginkgo biloba also showed fewer adverse effects, and this was the drug that we were testing for. Some weaknesses that we've seen were the administration of benzodiazepine and neuroleptics in certain participants. So this would kind of interfere with the consistency of the study because we don't know what patients took the benzodiazepines and neuroleptics and which didn't. Another weakness that we also seen was the age of participants. Some majority, the mean being about 68 years old. And as we mentioned before in the background, about 50% of patients that are over the age of 85 are usually patients that have Alzheimer's. Also, they didn't specify ethnicity and race. That may also have affected efficacy of the drug or how the drug worked in the body. Patient history was not included in the descriptives. This was another weakness. As you can tell, we did not know any pre-existing conditions for the patients or any medications that they were taking. The sample size was also small in comparison to the target population that they were going for. Also, there was bias loss to follow-up, which was another weakness.
So, in conclusion, the whole purpose of this study was to basically to see if there were more effective alternatives to Alzheimer's medications, because as we know, they are very expensive. So they wanted to see if there were alternatives that were cheaper and more effective and well tolerated. So the results did confirm that ginkgo shows significant clinical efficacy in Alzheimer's compared to donepezil. Compared with the donepezil group, the patient's attention, memory, and cognitive performance after 6 months of treatment, as measured by the SKT test, showed a comparable important improvement. And there was also significant improvement in CGI scores after 6 months in the patients reached with ginkgo compared with the improvement obtained by donepezil.
So some improvements and recommendations that we have for this study include increasing the sample size in order to further reduce bias and ensure that the results can be applied to the target population. We would also recommend that there be an addition of patient history and baseline medical conditions to understand if the drug efficacy was enhanced or diminished by outside factors. By this, we would like to see what other conditions that the patients had and what other medications that they were on. And we would also like to see an addition of medication logs throughout the duration of the study that would enhance the consistency of the study. So, as we said before, patients had access or were permitted to use benzodiazepine and neuroleptics, but it was not logged which patients used those or didn't use those. So that would also be beneficial to the study, and also consistency in medication administration. So when these patients took these medications, whether it be in the morning or at night or at all, would have helped strengthen this study.
So these are our references. We would like to thank the authors of the journal, and we would also like to thank Dr. Wingate for allowing us to do a journal critique. Thank you.
Thank you.